How do you see that digitalization as such is changing your work in practice? And what I mean with that question is that, generally speaking, in the pharma industry, in the digital health industry, we often hear about decentralized clinical trials, the fact that the whole care is moving into the home setting, which means that also the reporting, the monitoring needs to move there. And the next question is then, how do you ensure that the data that you capture is secure, and how do you even go about capturing the data from home and then transmit it to the doctor? So what's that like in your case? In the UK specifically, there's a lot of discussion about the uptake of so-called virtual clinical wards, which has just expanded over the pandemic. We talked about PROMs. I don't know to which extent do patients fill them out already at home? Does that impact how often do they need to go to the hospital because there's more care that's done virtually?
Probably break that down into three parts. First part is on security. Absolutely, security is the top mission. So we've done a lot of underpinning technical work to really shore up our foundations on infrastructure and cyber, and that's running a separate department from the work that we do. But that's been really important as well, to make sure that everyone we capture is secure, resilient, and we're up to all the compliance standards required of us. So that's the first part. The second part is really working on what's the governance process as well. So making sure the governance process is robust, and really we should focus on the governance process before we start having ideas about where that should be shared. Having that, making sure that ethics and that governance process is in place, really important. And then thirdly, on more where it's captured from and the sort of decentralized nature of it. The good part about the openEHR strategy that we're on is we are focusing on the data model first, and then secondly, we're focusing on where that data comes from. So that data could come from a device at home. That data could be filled in by the patient. That data could be filled in by a clinician. That data could be filled in by a hospital at another trust, but is sent to us. But in all those examples, it's all still going to be stored in a single longitudinal record, ideally with the same data models between. So that's really sort of core to the decentralized nature, really. As long as you've got standard data sets, the decentralized systems aren't too problematic.
Given that you emphasized a few times how important open data is for the changes that you're introducing, I'm just trying to imagine if someone is leading a digital transformation project of a hospital, what would your advice to them be?
I think definitely break that down into three parts. And number one is you've got to really focus not on the digital part first, but what's the organisational goals. And for the Christie, the organisational goals are quite different to many hospitals. So our organisational goals are cancer research in the first instance and delivering the best cancer care in the hospital and innovation. So I think that's the first part. The first part is don't necessarily dive into the tech. You've got to really focus on what's the organisational objective and do what's right for the organisation. Because what's right for one organisation is not necessarily right for another organisation. So that's the first part. The second part is really having senior buy-in for what you're doing. And that really helps if you've got senior people who have worked in or have knowledge of data as well. I was really lucky that at the time I did have someone, had a CIO that understood data and worked with data in other roles as well. So that's really powerful, because then that helps you convince all the other senior people around you. And then the third part is making sure that you've got the capability and the skills to be able to deliver what you want to deliver, because that's often the hardest part. And again, I was really lucky that we did have the capability and the skills already. There wasn't much of the capability that we needed to bring in. Mm-hmm. In the UK, we certainly have a skill shortage in digital and data. So that is one of the most important things is making sure you've got that in-house capability to deliver that support and that transformation